An urgent warning for those over 60: never combine vitamin B12 with these two common medications. If you are an older adult and you take vitamin B12 every morning, please pause for a moment and pay close attention to this information before your next dose. Right now, at this very instant, something critically important is unfolding within millions of older individuals, often entirely unnoticed. This concerning process frequently goes undetected because it doesn't manifest with typical alarm signals like pain, dizziness, or chest pressure. There are no immediate red flags that would make you put down your coffee and call your doctor. Yet, this silent situation is steadily, subtly, and dangerously increasing the risk of strokes and heart damage in people who genuinely believe they are doing everything right for their health. Many trust in one of the most reliable and widely consumed supplements, vitamin B12, often unaware that, under specific conditions, it can generate an unexpected danger when combined with certain common medications. This is a crucial piece of information that, regrettably, many healthcare professionals do not routinely share with their patients. The core of the issue arises when vitamin B12, especially in higher doses, is combined with one of two particular common medications. This combination can lead to the production and accumulation of a molecule known as homocysteine. Imagine homocysteine acting like tiny, abrasive particles of sandpaper. These particles can silently begin to chafe against the delicate inner walls of your arteries. Over time, this persistent, unseen irritation can significantly multiply your risk of experiencing a severe cardiovascular event, such as a stroke or other forms of heart disease. Today, we will explain precisely which two medications are dangerous to combine with B12 after the age of 60. More importantly, we will outline concrete steps you can take to protect yourself. It is absolutely essential to understand that this situation is far more prevalent than most people realize. It can affect anyone who follows a regimen of supplements and medications without the full, necessary knowledge of how these substances interact within the body. The real power lies in having the right information and in proactively managing your health. Before we delve deeper, here's a significant piece of data worth noting. A relevant study, published in a highly respected medical journal, revealed a surprising insight. It showed that older adults who were taking high doses of B vitamins, including B12 over an extended period, actually demonstrated an increased cardiovascular risk under certain specific conditions compared to those taking lower, more moderate doses. There wasn't a decrease in risk, but rather an increase, which initially proved astonishing to many in the medical field. However, once the underlying mechanisms were understood, the findings began to make perfect sense. Consider the experience of a very sharp and energetic 71-year-old individual, a retired school teacher. Every morning, they would go for a walk and then meticulously take a handful of supplements with breakfast. This routine was based on the common understanding that after 60, the body doesn't absorb nutrients as efficiently as it once did. Vitamin B12 was a priority in their supplement regimen, and they felt a sense of pride in being so proactive about their health and well-being. What this person did not know, however, was that they had been taking metformin for type 2 diabetes for nearly 8 years. Throughout that entire period, no one had explained the profound effect metformin can have on B12 absorption over time, nor the cascade of events that unfolds when the body attempts to compensate for that deficiency. Over recent months, their family began to notice that their parent seemed more tired than usual. This wasn't the kind of tiredness that a good night's sleep could fix. It was a persistent, deep sense of exhaustion that seemed to linger. The parent simply attributed this fatigue to the natural process of aging. When comprehensive blood tests were eventually performed, including a measurement of homocysteine levels, the results revealed a pattern that is unfortunately becoming increasingly common. Their homocysteine levels were dangerously elevated. Paradoxically, their B12 levels were also high, a direct result of their consistent supplementation. Yet the combination of these two results painted a disturbing picture, a history of silent vascular damage that had been quietly developing for years, all while this diligent individual believed they were doing everything correctly to maintain their health. This account serves as a stark illustration of how the seemingly beneficial combination of B12 and certain medications can inadvertently create a problem that standard medical checkups rarely detect. The first medication we must discuss is metformin. If you live with type 2 diabetes, it is highly probable that you are taking this drug. Metformin is one of the most widely prescribed medications for managing blood sugar levels, and it is indeed very effective in its primary function. However, metformin comes with a crucial side effect that most patients are never clearly informed about, or at least not in a way that highlights its long-term implications. Over time, especially after years of continuous use, metformin subtly interferes with the specific protein found in the gut called intrinsic factor. Think of intrinsic factor as a specialized shuttle or a taxi for vitamin B12. When you consume B12, this intrinsic factor picks up the vitamin and transports it to where it needs to go to be absorbed into your bloodstream. Metformin in its quiet action can gradually damage this crucial transport system, making it less reliable and less efficient. This disruption often leads to a perplexing situation. A doctor might see low B12 levels in routine blood tests and logically recommend a B12 supplement. So the individual goes out and purchases a high-dose B12 supplement, perhaps thinking that more is better. For a period, their blood B12 levels do increase, and the doctor might conclude that everything appears to be in order. However, what those standard blood tests often fail to reveal is the critical process happening further downstream. When B12 cannot be properly processed and transported due to the damage to the intrinsic factor system, it begins to interact poorly with another molecule in the blood, homocysteine. This is precisely where the situation becomes genuinely dangerous. Homocysteine is an amino acid that your body naturally produces. In small, well-regulated quantities, it is harmless and part of normal metabolic processes. Your body effectively uses B vitamins, including B12, B6, and folate, to convert homocysteine into something useful or to eliminate it from the bloodstream. However, when this vital conversion process is disrupted, perhaps because B12 isn't being absorbed or processed correctly due to medication interference, homocysteine begins to accumulate. Elevated levels of homocysteine in the blood have a very specific and damaging effect on the cardiovascular system. They act much like those abrasive particles we described, silently scouring the internal walls of your arteries. In fact, a team of researchers at a prestigious medical school vividly described it this way. Elevated homocysteine does not cause a sudden blockage like a clot does. Instead, it causes chronic abrasion. It inflames the arterial wall, makes it stiff, and facilitates the formation of plaque. It also hinders the blood vessel's natural ability to expand and contract as a healthy artery should, impairing its flexibility and responsiveness. Imagine your arteries as a flexible rubber hose. When they are healthy, they stretch and recoil with every beat of your heart, adapting to changes in blood flow and pressure. But when homocysteine has been continually scraping at those delicate walls for months or even years, that flexible hose gradually becomes more like a rigid plastic pipe. And rigid pipes, unlike flexible hoses, tend to crack. They don't flex under pressure, they break. In the critical cardiovascular system, such a rupture can tragically lead to a stroke or a severe cardiac event. This is precisely why it is so crucial to be aware of this specific interaction, particularly if you have been taking metformin for an extended period and also supplement with B12. This silent combination of metformin and B12 supplementation is occurring in the bodies of countless individuals every single day, yet very few people are connecting these vital dots. Understanding this connection is the first step toward proactive health management and preventing potentially devastating outcomes. Now, let's turn our attention to the second medication that is important to mention. This drug is taken by even more people than metformin, and its interaction with B12, while different, can be even more unpredictable in some respects. We are referring to proton pump inhibitors, commonly known as PPIs. These are medications like omeprazole and pantoprazole, which are prescribed to reduce stomach acid. They are widely prescribed for conditions such as acid reflux, acid damage, and ulcer protection, and they are extraordinarily common among older adults. This is partly because acid reflux tends to become more prevalent after the age of 60, as the digestive system naturally undergoes changes. However, PPIs perform another action that most individuals never hear about when they pick up their prescription at the pharmacy. By design, they significantly reduce stomach acid. While this helps with reflux, that very stomach acid is absolutely necessary to properly release B12 from the food you eat. Your body requires an acidic environment to break down the protein bonds that naturally hold vitamin B12 within various foods. When that essential acid is consistently reduced by a PPI, especially over months and years of use, the absorption of dietary B12 decreases significantly. A comprehensive study published in a respected medical journal tracked over 25,000 patients on long-term PPI therapy. It found that after just 2 years of continuous use, patients taking PPIs showed measurably lower serum B12 levels. Following this common finding, what do most doctors typically recommend? Naturally, they advise a B12 supplement, which, on the surface, seems like a perfectly sensible solution to the apparent deficiency. The real problem, however, lies in how the body then handles this supplemental B12 in certain individuals. Especially in older adults who may have reduced kidney function, the B12 supplement is often not processed or eliminated from the body efficiently. Instead, it can accumulate in the bloodstream in a form that interacts poorly or inefficiently with the homocysteine cycle we discussed earlier. This suboptimal interaction allows homocysteine levels to rise, even with seemingly adequate B12 intake. There's an additional aspect of this process that is particularly concerning for long-term PPI users. Some patients on extended PPI therapy can develop a phenomenon known as rebound acid hypersecretion. This means that when they stop taking the medication, or even as the medication metabolizes and wears off overnight, the stomach produces an excessive amount of acid in a compensatory response. During this rebound window, a high-dose B12 supplement may be processed in an unpredictable environment. The absorption becomes erratic and inconsistent. Erratic absorption, unfortunately, translates directly to erratic management of homocysteine. Some days, the body's system might successfully clear homocysteine. Other days, it might not. This creates a complex and fluctuating situation that adds an additional layer of risk, underscoring the vital importance of having a thorough and detailed conversation with your healthcare provider about all your medications and supplements. This is where all the pieces we've covered truly connect. The homocysteine connection is at the very heart of this entire problem. Homocysteine is one of those crucial values that almost never appears on a standard blood test panel. Your doctor will typically check your cholesterol levels, your blood sugar, your thyroid function, and perhaps your total B12 level itself. However, homocysteine requires a separate test and must be specifically requested. Experts in cardiovascular health have increasingly characterized elevated homocysteine as a significant and often underestimated risk factor for cardiovascular diseases, particularly in adults over 60. Despite this, the vast majority of older adults have never had their homocysteine levels measured in their entire lives. The reason this is so critically important is that when your homocysteine levels remain consistently elevated for months and years, 3 concerning things occur within your cardiovascular system, contributing to long-term damage. First, the delicate inner lining of your arteries, known as the endothelium, becomes inflamed and begins to lose its natural smoothness and protective qualities. This inflammation is a foundational step in arterial damage. Second, small, oxidized particles of LDL cholesterol, often called bad cholesterol, find it much easier to embed themselves into those inflamed and roughened arterial walls, initiating and contributing to the formation of arterial plaques. Third, and this is a truly crucial point, the plaques that form in an inflamed environment with consistently high homocysteine are far more likely to be unstable. This means they are prone to rupture and detach from the arterial wall rather than remaining fixed. This last point is precisely what explains many strokes in individuals who do not show large visible blockages in medical imaging. The plaque was indeed there, but it was unstable and broke off, traveling to the brain. Researchers in leading clinics have discovered that elevated homocysteine is present in a disproportionately high number of these otherwise unexplained strokes. The cause wasn't a mystery, the right test simply was never ordered. This information is not intended to frighten you without purpose. On the contrary, it is designed to empower you with knowledge, returning control into your own hands. And now that you understand the silent processes occurring within the body, we will tell you exactly what you can do about it. The answer is emphatically not to stop taking B12 altogether. Vitamin B12 is truly essential, especially as we age beyond 60. Its deficiency can lead to serious health issues such as nerve damage, debilitating fatigue, cognitive impairment, and ironically, it also carries its own cardiovascular risk. The objective here is not to take less B12, but rather to take it more intelligently and effectively. In the first place, if you are currently taking metformin for diabetes, or a PPI like omeprazole or pantoprazole for acid reflux, the single most important action you can take right now is to ask your doctor to order a specific blood test. Request a measurement of your homocysteine level and, crucially, your active B12 level. Do not settle for just the total B12 in your blood. Insist on the active form, often called holotranscobalamin. This is the form your body actually uses. Total B12 levels can appear normal, while active B12 is dangerously low. This distinction is critical, and many standard lab panels unfortunately overlook it. Secondly, the form of B12 you take matters enormously. The vast majority of B12 supplements available on store shelves contain cyanocobalamin. This is the cheapest form to manufacture and requires your body to undergo several conversion steps before it can actually utilize it. For older adults, especially those taking metformin or PPIs, these internal conversion steps are often compromised or less efficient. The form known as methylcobalamin bypasses most of these conversion steps as it is already in an active, bioavailable, and usable state. Research published in specialized journals has consistently shown that methylcobalamin more reliably elevates functional B12 levels in older adults compared to cyanocobalamin, even at equivalent doses. Thirdly, the dosage of your B12 supplement is more important than most people realize. High-dose B12 supplements, often ranging from 1,000 to 5,000 micrograms daily, are commonly sold and taken. However, your body can only absorb a very small fraction of this without the intrinsic factor working correctly. The excess B12 then floods the bloodstream in a form that can, paradoxically, fuel the homocysteine imbalance we've discussed, contributing to arterial damage. A more targeted and specific dose, typically between 250 to 500 micrograms, in the form of methylcobalamin, taken alongside a supportive combination of B6 and folate, provides the homocysteine cycle with everything it needs to function correctly without overwhelming the system. Fourthly, and this cannot be overstated, have a dedicated conversation with your doctor specifically about your current medication list in relation to your supplements. Make this a primary agenda item for your next appointment. Frame it not as a casual question at the end of a checkup, but as a specific and important topic of discussion. You might say, I want to talk specifically about my B12 supplementation in the context of the medications I am currently taking. That focused conversation alone could significantly change the trajectory of your cardiovascular health. Consider another real-life example, that of a 74-year-old individual who had been taking a PPI for 14 years and a B12 supplement for the last 5 of those years. Their daughter, having independently learned about the risks of homocysteine and its impact on heart health, urged her parent to see a doctor, even bringing a printed article with her. Initially, the parent was skeptical. They felt perfectly fine, their blood pressure was controlled, and they walked their dogs every day. However, their homocysteine analysis yielded a result of 31 micromoles per liter. The universally accepted safe range is below 15. At 31, their level was more than double the threshold associated with a significantly elevated risk of stroke. Yet there were no symptoms, no warnings, no clues, just a number on a lab sheet that explained precisely why their arteries were silently working harder and enduring more stress than they should have been. Following these crucial results, the form of their B12 supplement was changed to methylcobalamin. A low-dose B6 and folate supplement was added to specifically support the homocysteine conversion pathway. The B12 was also strategically timed to be taken at a different point from the PPI dose to maximize its potential absorption and utilization. A follow-up homocysteine test was scheduled for 90 days later. When this person returned 3 months later, their homocysteine had significantly decreased to 17. It wasn't yet perfect, but it was moving decidedly in the right direction, a remarkable improvement. They commented that they hadn't realized how truly tired they had felt until they started to feel less exhausted, a common revelation for those who have silently carried high homocysteine for years. If you find yourself in a similar situation, having been on a combination of these medications and supplements for years, please know that it is absolutely not too late. The human body possesses a remarkable capacity to recover and rebalance itself when it is provided with what it truly needs and when harmful interactions are addressed. The vascular inflammation and damage caused by elevated homocysteine are often not permanent if detected before a major event. This case study powerfully demonstrated significant recovery in just 90 days, offering hope and a clear path forward. Here is a clear and actionable plan for your health. First, thoroughly review your current medications. Are you taking metformin for diabetes or a PPI such as omeprazole or pantoprazole for acid reflux? It is absolutely essential to know your complete and up-to-date medication list. Secondly, carefully examine your existing B12 supplement. What form is it? If it states cyanocobalamin, you need to seriously consider changing to methylcobalamin, which is more directly usable by the body, especially for older adults whose digestive and metabolic processes may be less efficient. Thirdly, verify your B12 dosage. If you are taking more than 1,000 micrograms daily, you might be overdoing it, and this could actually be counterproductive, contributing to the very problem you are trying to prevent. A more moderate, specific dose, typically in the range of 250 to 500 micrograms, is often more effective and safer. Fourthly, and most crucially, schedule a homocysteine test. Call your doctor tomorrow morning and specifically request a blood test for your homocysteine level alongside your active B12 level. Do not accept a total B12 test as sufficient. Insist on testing the active form. Fifthly, consider adding supportive B6 and folate supplementation. These two vitamins work in powerful synergy with B12 to process homocysteine adequately and efficiently, thereby optimizing the crucial metabolic cycle that keeps your arteries healthy. What you have learned today is this: metformin and B12 can create a dangerous interaction through the intrinsic factor pathway, leading to elevated homocysteine and silent arterial damage over time. Proton pump inhibitors reduce the acidic environment necessary for B12 absorption and can create an erratic processing environment that further disrupts the homocysteine cycle. Crucially, homocysteine is almost never tested in a standard blood panel, and elevated levels in older individuals represent a significant and dangerously underestimated cause of strokes and cardiovascular events. The solution is not to abandon B12, which is vital, but to transition to methylcobalamin in a smarter, more appropriate dose with the synergistic support of B6 and folate. If this information has helped you understand a hidden danger you were previously unaware of, please share it. Consider sharing it with someone over 60 who might be taking these common medications. Your simple act of sharing this knowledge could quite literally save someone from a life-altering stroke or a serious cardiac event. Please remember that this information should not be considered direct medical advice. Always consult with your healthcare professional before making any changes to your supplement routine or medication regimen, especially if you are currently taking prescription medications. Thank you for trusting this source for your health education today. Now you know something that most people are never told, and that critical knowledge belongs also to the people you love. Take care of your heart and empower those around you.